saw very quickly how it was affecting mental health nationally. Use of anti-anxiety medications spiked immediately, up by 34% over the prior year. And the rate of suicidal ideation doubled in some populations. At our inpatient unit, I saw patients being admitted who would not in normal times have needed to be in our hospital, like the accountant in her 40s who was admitted because the pandemic convinced her the world was literally coming to an end. And she could hear her dead father asking her to join him. Or the 50-year-old construction worker who had lost his sobriety because he couldn't find any in-person AA meetings anymore. They're all virtual. And he ended up tying cinder blocks to his wrist with the plan to jump into his pool. Luckily, he came to the hospital instead. So these and many other people have become overwhelmed during this pandemic, and our usual coping strategies just aren't working often. Tonight's event is sponsored by the Mystic Valley Behavioral Health Coalition, and this coalition was convened in January of 2020 through a partnership with Middlesex District Attorney Marian Ryan, MelroseWakefield Healthcare, the Mystic Valley Public Health Coalition, and the National Alliance on Mental Illness, and innumerable other member agencies which are listed on your screen, or you should be listed on your screen. One of the goals of the coalition is to offer education to the community on behavioral health topics. And tonight's speaker, Dr. Christine Runyan, will address the concerns we all have when making choices for our families during the pandemic. So before we start, just I have a couple of housekeeping issues. Your microphone will be muted throughout the evening, but please send your questions through the question answer feature, which will be monitored throughout the program. We're so glad you joined us. So now it's my pleasure to hand off the program to Middlesex County District Attorney Marian Ryan, who's a convening partner who's graciously offered to moderate the program for us this evening. Marian?
Thank you, Doctor. Thank you all for being with us tonight, and thank you as well to the panelists and to the folks at the hospital and in the coalition that have put so much work into this program over the last few months. And to begin, it's my pleasure to call upon some of our other stakeholders to talk for just a moment about what you heard Judge Dr. Carlat speak about, which is really the very real issues that we have seen developing in so many of our populations in the last 7 months. And as we think about heading into the winter and all of the seasonal affective issues that we have every year, these things have become so much more important. So nights like this are made possible only with support from so many of our community leaders. And we're going to begin by hearing a little bit from the mayor of Malden, the city that has contributed so much to this, and Mayor Christensen is here with us from Malden. Not? All right. All right, well, maybe he's having a little bit of trouble getting in. Turning to Melrose, obviously we're the Melrose Wakefield Hospital. If we were not in Zoom land, we would be. And a really great partner in this effort, someone who began in our office, the DA's office, served in the legislature, and now has the honor of serving as the mayor of Melrose, Mayor Broder.
Thank you, District Attorney Ryan. I very much appreciate the opportunity to semi-host an electronic event like this. You know, throughout my career, starting in the DA's office and some of my work with elders and in the legislature now as the mayor, one thing rings true about human resource and human needs is that ability, that need to connect, that ability to be able to reach out to folks. Sometimes it's a peer-to-peer situation. Sometimes you need a professional connection or clinical help. And we've seen it in elder isolation. You see it in the opioid crisis. You see it in, unfortunately, the growth in incidences of domestic violence. And layered on top of that with COVID is this inability to make those connections. I very much appreciate this opportunity that the coalition is giving the communities, the surrounding communities as well, to figure out how to remake those connections, because we really are dealing with a pandemic within a pandemic. And you folks have all been on the front lines, and we very much appreciate the support and the assistance in making sure the communities that we have the responsibility for taking care of are having their needs met in this very unique and challenging times. Thank you very much.
Thank you, Mr. Mayor. And turning to Medford, as you heard, the Mystic Valley Coalition has been a big part of these efforts. And we are hopefully joined by Mayor Brianna Longo-Curran.
Yes, thank you, Attorney Ryan. I first want to thank everybody for being here and thank the team from Medford. I know we have a few members on. Good evening and thank you for having me. I want to thank the Regional Behavioral Health Coalition for hosting this important discussion, especially following up on the robust community process you completed last year. I know that there are a number of issues and topic areas that the coalition plans to continue its work on, but the COVID-19 pandemic has increased challenges for so many residents within our service areas, and it's even more important that we work together to make sure everyone has access to the resources and the care they need during this critical time. As we are continuing to feel the impacts of the global pandemic, both physically and emotionally, and especially as our kids are having to work through a difficult new normal with remote and hybrid learning, focusing on these challenges and how we can support one another in our communities is so important. Thank you again for the invitation to join this evening, and I really look forward to continuing our partnership and collaboration in the future.
Thank you, Madam Mayor. And from Wakefield, we're fortunate to have with us the Town Administrator, Steve Mayo.
Thank you. Thank you very much, District Attorney Ryan. In Wakefield, by the way, we call it the Wakefield Melrose Hospital. So just let's get that straight. But anyway, the town of Wakefield is very proud to be part of this important collaboration. And through our work with schools in the community, we have learned so much about many of the unique stresses this pandemic is putting on individuals and families. Having to make decisions about what activities to engage in, whether to visit their parents, whether to go to someone's for Thanksgiving. Everyone is grappling with this. And we are so thankful to Melrose Wakefield Healthcare for taking the lead on this event. As a town, we have committed to supporting our residents' need for mental health. Over the past years, the town of Wakefield has implemented several efforts to address the growing demand. The town has partnered with LA Community Services, which I believe is on tonight, and increased our police department's embedded clinical social worker from part-time to full-time, and brought on a part-time recovery coach. Combined, these two individuals have worked with over 400 individuals and families over the past 2 years. The town and the schools also contact with Interface Referral Service to connect residents of any age to mental health care. Over the past 7 months, this service has seen significant increases in demand from Wakefield and other communities in this region. I was struck by something Dr. Carlat said in the beginning of the program tonight, how hard it was for people to go to in-person AA meetings, how difficult it was for that members of our population. In Wakefield, I think I spent most of March and April shooing people from going around our lake, getting a lot of complaints from people gathering, they're gathering too close. And one group that meant every day was a big circle of people down at our common every day that they could. And I wondered what they were. Went down there and talked to them. And it was the local AA group through one of our local churches. They met at one of the local churches. And what I said to them is that they were doing everything right. They were social distancing, not to worry about anything. We were there for them to help them. And then I had to go and contact some people in the community that had been, calling the police or calling the health department about, we have a group at the lake, what are they doing? And that group that I talked to that were complaining became advocates. And I think that's something that we need to do, and working together, we'll become advocates. So grateful to be part of this regional coalition, and look forward to taking any proactive steps to support people during this time. Thank you.
Thanks, Steve. And from Malden, I see that we have Mayor Gary Christensen here with us to welcome it on behalf of Malden.
Great. Thank you, District Attorney, and good evening, everyone. And I have to admit, they asked me to come on and speak about addressing mental health and well-being here in Malden and regionally, but I have to say, I really want to just take this opportunity to say thank you to you all for what you have done. Now that we're 6 or 7 months into this pandemic, looking back, I don't know where we would be without all of you. So it's just really refreshing to see Malden Overcoming Addiction, the Malden Warming Center, Mystic Valley Elder Services, Portal to Hope, Hallmark Health, because finally, we haven't had the chance really in the past several months, but finally I get the chance to say thank you for what you have been doing for our city. There's no way that I believe we would be where we are today without your support. So I just wanted to offer that, and also say, in order for us to move forward, we're going to need your help more than ever. And just this morning in my weekly meeting with our police chief, Kevin Molis, we actually have someone living in our police station. That's just how bad things are becoming out on the street. So, I hate to do this to you all because you're already doing so much, but we're going to need even more of you going forward. And I, as one, along with the other mayors and town managers here, just wanted to assure you that we will be here to do what we can to help you help us, because from what I see, that is going to be the only way forward.
Thank you, Mr. Mayor. And, really so many of the programs that you've heard mentioned from our speakers have a base at Melrose Wakefield. And I'm particularly happy to have here our real host tonight, Susan Sandberg, the CEO of Melrose Wakefield Healthcare. So thank you for the wonderful people that are on your team, for the participation and support that we receive from the hospital for so many programs, and for the work done to put tonight together.
Thank you, Attorney Ryan. We really appreciate being part of this collaborative. As a nurse myself, I take healthcare very seriously. When we're now in the 7th month of a pandemic that none of us have ever lived through before, I know people are weary, I know people are fatigued, and I know the behavioral health needs are growing. The COVID pandemic is getting a lot of press about the healthcare we give for the respiratory symptoms, but I think these symptoms are just as important, and it's very enlightening and wonderful to see so many people here to learn tonight. So, and we are very proud to be part of this. So glad to have Dr. Carlat on our team and to be able to sit back and listen to Dr. Runyan tonight. So thanks all of you. It is an honor to work in this community. When you see the mayors and town administrators coming, you know how important this topic is and how important this is to all of us in the community. So I thank all of you leaders also. Thank you.
Thank you. And now it's really my pleasure to introduce this evening's speaker. As you've heard, Dr. Christine Runyan. And, in the early stages when we were completely ordered to stay at home and there wasn't much to be doing, we didn't face some of the decisions that we're facing now. And invariably, as we're getting to the holidays, there's lots of things that are coming up, and how do you make those safe decisions? And Tina is really well positioned to be giving us some advice about that. She is a clinical psychologist at UMass Memorial Medical Center, as well as a professor in the Department of Family Medicine and Community Health. She really has focused her skills in the place of integrated primary care. And she's on the advisory board for the Center for Integrated Primary Care. She teaches and trains on these issues. She's also really focused on providers and physicians and helping them to give primary care in a collaborative way. She's been recognized nationally for that work. And she's also spent a good portion of her work on developing and implementing education, training, and policies to promote clinician well-being. You heard a little bit about how we're all tired. Well, all of the people who are helping are tired as well. So that's really a very important topic. And tonight she's going to turn her wisdom to how we might be thinking about making these decisions during these troubling times, the next few months as we head into what seems to be the winter and maybe the flu season and the continuation of the pandemic. And how do we support our own well-being as well as the people that we live with, love, and work with? So, Dr. Runyan, we're delighted to have you here tonight.
Thank you, DA Ryan. Lovely introduction, very gracious. I too am delighted to be here, very honored to be a part of this. Very heartwarming to hear all of those introductions and all of that endorsement, and really excited for that story that Steve Mayo shared about Wakefield and how the complainers became the advocates. And that's so much of that story. I hope I can give you the backdrop maybe of how that came to be and what I'm going to share this evening. So I have to apologize in advance that I don't have the 7 steps to making the best decision. I don't have any quick answers, but I do hope that the what I'm going to share tonight and the comments I will provide will actually offer a little bit of explanation, perhaps, for why we are seeing such a rise in the behavioral health issues in our communities that span everything from intimate partner violence to lapses and relapses in addiction, as well as some of the very sad stories that Dr. Carlat shared in the start of this. And so my hope is really to provide a little bit of a backdrop for those of you that don't have a background in behavioral health, that might help explain a little bit about why some of this might be happening before I move to be able to talk about how do we make really wise and thoughtful decisions. So I do have some slides that I'm going to put up. So I'm going to try and share my screen here. Hopefully there's no technological difficulties. If there are, we do have a backup copy of slides. So let's see if I can advance these. Start of the technical difficulties. I am not able to advance my slides, so I can share my screen, but we didn't practice that. We practiced getting them up, but we didn't practice sharing that. Let me see. Katie, would you be able to man the slides and I can just let you know how to advance them? Would that work?
I will get the slides up and share my screen in just 1 minute.
Okay, that sounds great. Thank you. All right. So without slides, I just want to start by acknowledging that we are, as everyone has, that we are in the middle of, choose a word, right? Challenging times, difficult times, unprecedented times. And that makes it really hard sometimes to sort of see what's actually here and the beauty that's here and the things that really are solid and predictable and known. That when we're in the middle of this, it feels we are in the middle of a bridge and we don't quite know, are we at the halfway point or not? And that makes it really challenging to trust. And it really creates an atmosphere of uncertainty. And our brains, our human brains, do not like uncertainty. And when we have been living in a state of chronic, unmitigated uncertainty, and as soon as we feel like we have some certainty, oh, it changes. And we're seeing that real time play out with changes related to, what's happening in schools and people having to make decisions on a real time basis. Thank you, Katie. You can fast forward to, yep, you can fast forward that. This is just bringing a little bit of light to the fact that we are living in uncertainty. And like I said, our brains don't like it. You can go to the next slide. So uncertainty biologically, physiologically, is like rocket fuel for fear. And when we are in a fear response, our survival brain kicks in. And most of you have probably heard this term fight, flight, or freeze. And the reason I'm starting here is because I don't feel like I can move towards how do we make decisions until we have an appreciation for understanding that when our survival brain is activated, it is releasing a slew of chemicals and neurotransmitters throughout our body that our body is responding to. And when there's an actual threat, that's really, really useful. It's actually an exquisitely designed system that can really help us activate in an instant without having to think about anything. Our heart rate goes up, our blood goes to our major muscle groups, our breathing changes, our eyes dilate so that our vision is better. All sorts of magical things happen when there's a threat. But if you apply it to these times we're living in, again, sort of chronic, unmitigated threat that is known but not detectable. So like in this picture, we know there's something out there. We can't see it, but we know it's there, and we're not quite sure who might be the carrier, who might be the person that really presents that risk for us. When that happens and you have that stress response going on and you're living from that place, it's not a place where we can make the best and wisest decisions about anything. This is also why in Dr. Cartlat's introduction, he talked about cases coming in of people who otherwise would be able to manage just fine with their outpatient care. It's why you're seeing this resurgence of lapses and relapses in terms of addiction. And for anybody who's had any prior trauma, it's why you're seeing a resurgence of trauma reactivated, not because anything with COVID looks, smells, feels, tastes like any prior trauma somebody experienced, but because that common element of lack of safety and vulnerability is familiar. And that reactivates a lot of prior trauma. So that's the backdrop in which we're seeing all the whole level of the tide rise in terms of behavioral health, because our brains don't like uncertainty and it makes us feel really unsafe. So when we feel unsafe as humans, we have a way of trying to deal with that. You can go to the next slide, Katie, please. The way we deal with that is we get into groups and we try to affiliate because we're safer in numbers and we feel stronger. And that's a biological response. We are evolutionary social primates. And so we get into groups and we gather, and that makes us feel stronger and better and reduces that survival brain. It reduces our stress response. But the other thing it does is it keeps us pretty locked in to scanning for threat. And so I introduced this using Dr. Seuss. He's good for so many things. And I don't know if you're familiar with this book. He wrote it actually much later in his life, in the 1980s, the Butter Battle book. And this is a book where there's two camps. There's the Ukes who wear blue and they're on one side of the wall and they really love their bread butter side up. And then there's the Zooks, and the Zooks wear orange and they insist that the bread only tastes wonderful with butter side down. And while this may seem very, very trivial, you can hit the space button, Katie. What it does is it emphasizes a stance of I am right and you are wrong. Because when we get into these groups to affiliate, we really instinctively go in group, out group. Because partway to know that we're in the in group is to be able to define the out group. And so in the Butter Battle book, this escalates, this argument over whether the bread should be butter side up or butter side down escalates from a slingshot, somebody making a slingshot and attacking one side to the other side, making a bigger and better slingshot, and it just ratchets up to eventually both sides are in possession of a really destructive red bomb that neither side can defend against. And of course, it's Dr. Seuss, so he gives it a really cutesy name, the Bitsy Big Boy Bomberoo. But neither side can defend against it. And the child asked his grandfather, well, who's going to drop it? You or them? And the grandfather's reply is, be patient. We'll see. We will see. And if you're a Dr. Seuss fan, that's actually a pretty unsatisfying end to a Dr. Seuss book. Usually he just sort of buttons it all up and puts a nice little bow at the end, and we can go about our day feeling very good. So it's, again, it's imbued with uncertainty. But this is what we're living in. And when most of us have this uncertainty, we will do most anything to try to feel in control, to try to quiet the nervous system. Unfortunately, what we turn to is often more activating. Next slide, Katie. We will actually sacrifice some of our biological needs for this psychological drive. And we do that by seeking more and more and more information. And sometimes that just really clouds the picture of how we make decisions and keeps our nervous system pretty highly activated. And what we don't tap into is that we are all subject to biases. And we're subject to biases in what we see and what we hear. Next slide. I'm just going to give you a little taste, a little example of what I mean by that. This is a slide where there's actually 12 black dots that are at some of these intersections. And if you try to have your eyes focused to capture all 12 dots, you'll notice that you can only hold 2, maybe 3 in your visual field at a time. It's an illusion. Oh, sorry, stay on that slide for a minute. It's an illusion. And that's how magic works. That's how magicians fool and delight us. It's also why you can probably read what's at the bottom of this same slide, not because it's spelled correctly, but because it has all of the elements, all of the letters are correct. And so our brain actually does the translation for us, and it interprets what that is supposed to say. It creates a shortcut, and so you're able to read that. So these are some visual things, some visual biases that we have, and I present them just because they're easier to present in this format. But we also have cognitive biases. And one of those cognitive biases that we all have as humans is what's called a confirmation bias. And it's a bias that really helps us to be very efficient in understanding information or taking in information and not be slogged down in the amount of information. And that confirmation bias leads us to really latch on to information that's really consistent with what we already believe to be true, and be quite dismissive or even ignore information that doesn't fit with our current belief. And the reason this is so important in today's day and age, you can go to the next slide, Katie, please, is that we are actually not living in a shared reality because in part of this confirmation bias. Yeah, one back. And we have all, we are all in a massive unconsented social experiment with social media. And if you haven't seen the documentary, The Social Dilemma, I highly recommend it because there's some tech insiders that really shine light on what has actually been a fairly pervasive problem in this space for a long time. And there's actually a very diabolical and intentional manipulation of information that's coming at all of us. And while it was originally designed to just maximize profits, it's being used in much more nefarious and dangerous ways now to really manipulate people's perceptions and understanding of reality, and to hijack and capture our attention, So we stay really focused on what they want us to focus on. And the reason I bring that up is not to get on a soapbox about the perils of social media, but in this time of uncertainty. So when our brains are saying, I don't like this, your stress response is really present, you're really activated, we will seek information to try to calm our stress response, but we're doing so unless we are very aware that we have these biases operating and we have this very intentional manipulation in the background. And we can't change we can't drop our biases. We can be aware of them, but we're all pre-programmed with those biases. And so to understand, to just have that awareness that sometimes the processes we use to make decisions may not be serving us in the best way. So we can go to the next slide. And so I'm going to offer this little parable just as an example of this. This is a transcript of a radio conversation between the U.S. and Canada, and it's set in the seas off the coast of Newfoundland. And the U.S. ship says, "Please divert your course 0.5 degrees to the south to avoid a collision." And the Canadians reply, "Recommend you divert your course 15 degrees to the south to avoid a collision." And the U.S. ship says, "This is the captain of a U.S. Navy ship. I say again, divert your course." To which the Canadians reply, "No, I say again, divert your course." And the U.S. ship now quite loudly says, "This is the aircraft carrier of a U.S. Navy ship. We are a large warship of the U.S. Navy. Divert your course now." To which the Canadians reply, "This is the lighthouse. Your call." And so I offer that just really as a lighthearted example of we can get really caught in the stories we tell ourselves. And those stories we tell ourselves may not always be serving us in the best way. And if we really want to move forward, and so many people intimated this in their introductory remarks, which was just beautiful. We can go to the next slide. If we really want to move in this midst of this pandemic, not to mention all of the other things that ail us right now in terms of the suffering of our earth and the racial divide and injustice in this country, and all we could list them. 2020 has not been kind on so many fronts. If we really want to move in a direction towards healing, we have to root down in the interconnectedness of all of our humanity. And so this is, if you haven't been there, this is the Martin Luther King monument in DC. It's my favorite of the monuments. And he says, "We are caught in an inescapable network of mutuality, tied in a single garment of destiny." And that was, so many years ago and so present today in terms of how we move forward in the midst of this pandemic. And I just want to do a call out. When I was reading the needs assessment of the Regional Behavioral Health Coalition and reading from there what the strengths were, the stakeholders said that the strengths were, the major strengths were that it was a very diverse population in all these communities, right? And seeing the idea that some like butter side up and some like butter side down, that's a strength. So just viewing that. And then the other strengths all had to do with a collaborative approach, building strong partnerships, and a willingness to support and cooperate with local service agencies, healthcare agencies. It was like the coalition just nailed it in terms of what is the scaffolding? What is the backdrop that's really going to help nudge the needle on all the suffering that's here in these communities? And so we can go to the next slide, Katie. And so there is another option, right? Instead of this constant churn, there is another option. And so I'd like to spend now a little bit of time talking about how we make decisions and how we deal with decisions that other people are making that may not be aligned with us. How we deal with the pick your side, the butter side upside or the butter side downside, how we deal with that. So the first tip that I want to offer is just recognize when you're caught in that reactivity, when you're caught with that survival brain that's really just trying to do you a favor. It's trying to keep you safe and it's trying to keep you alive. But it's such a good threat detection system that it fires when there's not actually a real threat to your physical safety. Mine fires because we have lots of ways of in-grouping and out-grouping. We can wear, particular signs on our body through t-shirts, and we can adorn our lawns with signs that really, sort of stake our claim. And when I walk by and I see somebody's lawn with accessories that don't match my beliefs, I have a visceral response. I get activated. And what I can do in that moment is do this in-group, out-group thing, this bad othering, and pretend that I know everything about the people that live in that house and what they believe in and what they stand for. And I can really double down on this confirmation bias. Or I can recognize that that's just my survival brain detecting some threat. It's detecting that they like to butter their bread on the wrong side. And then I can name it. I can kind of do a U-turn and just recognize that, oh, that's activation. And when I name that, I tame it. It's true with any strong emotions that we have. When we name it, we tame it. And that's because you move from that survival brain up to use this part of our brain, which is our prefrontal cortex, our thinking part of our brain. And when we can name something, we actually recruit our thinking part of our brain to help us. So we're not so driven just out of a sense of need to be safe, need to stay alive. When that system's activating, we get a lot more activation and a lot more tension. And so like in that early example, like that group that was able to end up be advocates for the AA group after complaining, right? They were able to really U-turn. And they probably used, without naming it, a strategy that I call just like me. And just like me is getting closer to the reality that, oh, they like bread too. They like buttered bread too. And so while we may disagree about butter side up or butter side down, what's shared is that we both like buttered bread. And so a just like me strategy is seeing that just like me, they want to be safe and happy and free of suffering. And they want the people that they love and care about to be safe and happy and free of suffering, just like me. That's what I want too. Now, we may come at that from very different pathways, and I'm not suggesting that we abandon our beliefs or our values in any way. In fact, when we can really root down without our survival system guiding that, that's when you hear the, I believe this, and this is why that side's completely wrong. That's the bad othering, as opposed to I believe this, and I'm going to work tirelessly to basically make that come to fruition and make that a reality without necessarily having to distance or create a narrative around other people being bad. So that's the just like me strategy. It's really worked for me. Another one is one that we teach, we all learned in kindergarten. We teach, our kids this. Some of you probably, have your grandkids learning this, which is just, stop, pause, take 10 breaths. The beauty is it doesn't actually take 10 breaths. You can actually start to quiet the nervous system with even one breath. So we could all do that now together. We could take one deep breath through the nose and a very long exhale. And you could take a second one if that feels good for you. The reason this works is because we all come preloaded with the same software. And just like we have software for a stress response when we really need it, we also have software for a relaxation response, a rest and digest system. And just by using some of these strategies, we can activate it. So you can take a breath, you could place a hand on your heart. That connection is known to all of us biologically. It's the original caregiver's love, that connection, or a smile, literally a smile. These are all states that are inconsistent physiologically, inconsistent in our body with a stress response. So even if we can't totally get there in our thoughts, we can use this in our body to calm the stress response. And so the final thing I would say is to, check your assumptions and check your perceptions about people. What are the stories that we're telling ourselves about the people who like their bread buttered on the other side? And I think Miller Williams said it best when he said, have compassion for everyone you meet. What seems like deceit, bad manners, or cynicism is always a sign of things no ears have heard, no eyes have seen. You do not know what wars are going on down there where the spirit meets the bone. And I just love that because we truly don't know what somebody's carrying. A quick example from my own life, I was in Trader Joe's a couple of weeks ago, and I have been choosing to go to that grocery store because the people at the checkout are very, very friendly. I feel like they have it really dialed in the line. You line up for checkout, and then there's one person that sort of directs you to the next available checkout person. And so I was in that line with my daughter. I think we were one or two back from the front. And she said, oh, I forgot, I wanted to get peanut sauce. So she peels off and I stay in line. And pretty soon, in a couple of seconds, I hear a very loud exchange without hearing the words, but I hear a loud exchange behind me. And I turn around, and it's a woman behind me with her mask down, speaking very loudly to my daughter. And I was very activated. Initially, all of that sort of very primal kind of, survival, like what's happening, wanting to protect my daughter. And what had happened is this woman had her mask down. My daughter was going to get her peanut sauce, and she said, ma'am, when you don't wear your mask, you're putting your life and everybody else's life at risk. Please wear your mask. Which really activated this woman, who began telling her, well, you know what you can't do? You can't have your mom stay in line and you go off and get the rest of your groceries. And so I turned around and I said, ma'am, what's going on? And she was at this point quite activated, and she was telling me to just mind my own business and to turn around. And I tried once again. I said, I don't even know what happened. What happened? And she didn't, she was quite angry. And so I did. I turned around and I put my hand on my heart and I just breathed. And I just took a long breath in and a long breath out. And that's all I did. And about 3 minutes later, she said, excuse me, ma'am, I'm really sorry. I don't know what got into me. This is just about groceries and buying groceries on a weekend. I'm really sorry. And I said, yeah, I think we're all having a really tough time. Apology accepted. And so it may not work all the time, but taking care of ourselves in that way, when we don't really appreciate how other people may be handling their own angst and suffering, can be a really useful tool to hold on to. Now, about making your own choices, we can go to the next slide, Katie. So another cognitive bias that we all have is this thing called the bandwagon effect, or the groupthink effect. And the reason it's a bias is it can be really useful. We as an individual don't have to sort through all the information to come to a decision or a conclusion. We can sort of go with trusted people in the group. And sometimes that's really a smart thing to do, particularly, you know, if those people are your public health experts who deep bow of gratitude, who are working tirelessly in these past 7 months. And other times it can create some confusion for us, because sometimes there's multiple groups that we affiliate with and they're making decisions at odds with one another. And so my suggestion for how to manage your own choices is to really quiet the noise coming in and to maybe create some space in physical distance, in time, for you to be able to drop in to your own wisdom, to your own sense of what's right for you and people you love and care about and people you're responsible to at this moment of time. It may change, but to really drop into that and trust that the wisest part of yourself will actually allow your truth to emerge in terms of, what do I do now? It is also true that you may find that there's competing values that come up when you really sink into what's right for me, the value of needing to connect and be with people, and the value of safety may really come head to head when you get quiet and honest with yourself. And I'm not a public health expert, but I think I would, in the short term, always lean toward the side of safety, which may not mean you can't fulfill this other value. It may just needing to be doing it in a more creative and innovative way. But to really, as best you can, resist getting caught up in that groupthink, in that bias. And the other thing I would say is to try to separate the choice from the person, right? So to not get into the in-group, out-group, or to make assumptions about what other people think, believe, feel, because they're making this particular choice. I started practicing this with my dog, really, because there's such a tendency to say good dog, bad dog. And I would do it when I'm walking my dog, and he would invariably find something on the side of the road that he would choose to eat. And I knew I was going to be responsible for cleaning it up later in the day when he vomited it on the floor. And so I really have tried to work with bad behavior. And it's a little bit, it's a little tongue in cheek, but when you can see that, particularly for, an animal, then we can see that, oh, us too, right? And that, can we do that for ourselves? Because truly, we are building this bridge as we are walking on it. And for anyone to say that they have, they can provide certainty and they have all the answers, it might be attractive and feel good in the moment, but it's simply not true. And so to be flexible in your thinking and to be really kind, for a choice you make today may be different than the choice you make in a week. And we have this bias and tendency to evaluate our past choices based on our current information. And this is really present now in the pandemic. And so your past choice was based on the best information that you had at the time. And your current choice is going to be based on the best information you have at the time. But to not make the mistake of evaluating your past choice based on the current set of information, because it's changing all the time. So being able to be really flexible with that. Next slide. And so I don't have an answer of whether you should trick or treat, whether you should take your kids trick or treating, whether you should be giving out candy or not. What I can say is those principles I just discussed, you could use those. You could try those to see and consult your public health officials, that too, to see how that plays out for you, to make your decision that's based for you and the people that you love and care about. And maybe check in and say, you know, what story am I telling myself about Halloween 2020? And how important will this be at Halloween 2021? And see if you can work with, you know, the uncertainty in a way that brings the survival brain down, so that it's not being made from the story you're telling yourself, but really grounded in what's true for you based on the best available evidence. You can go to the next slide. Because I think this is why we're seeing such a rise in behavioral health issues, all the reasons I just discussed. And Dr. Carlat is right. A lot of the coping strategies that people typically rely on, a lot of the structure and the guardrails that people build into their lives to manage addiction, to manage depression and trauma and isolation are really falling apart, and that's really hard. And so here's what I think are sort of the most accessible and highest yield coping strategies that still aren't going to prevent, you know, those excess numbers in behavioral health needs, but might help some and help move us in the right direction. So exercise, any kind of movement, and that's because this has a biological basis in stress reduction. It, again, releases hormones and chemicals in our body. And so to use that to your advantage, and it doesn't have to be going out and doing a 5-mile run. It can be any kind of intentional movement. The other one is gratitude and savoring. And so really being able to touch in that in New England, you know, the sky is raining gold and red and yellow leaves on a regular basis. It's breathtaking. There's still a few bluebirds who are gracing us with their presence that we can know. And as caregivers, in any way, I mean that term very broadly, when we can have gratitude and we can know that they're suffering, but also touch into that space of gratitude for ourselves, we're going to be much more capable of being able to stay in a stance of compassion for others. And so savoring, really taking those moments where actually in this moment, everything's okay. And to really savor that and to be with that fully. Not surprisingly, my next one is dial down the inputs or be very selective about the inputs. And to know that there's a whole, you know, artificial intelligence operation that's outside of your field of vision that is contributing to what you see. And if you find yourself in that really contracted state, we know that state in our bodies. Our hearts are armored, we're tight, we're contracted, and we're doing this me versus them thing. And if you find yourself getting in that space, my suggestion is dial down the inputs as best you can. And because we're affected by what comes into our visual field, what comes into our auditory field, and see if we can change that a bit. The fourth one is sleep, and to be really, really vigilant and uncompromising on your sleep. It's where we consolidate memories and information. It's where we rest our hearts. It's where we rest on a cellular level. And if you're battling anything because of prior trauma, because of addiction, you know, sleep can be a coping strategy sort of at the extreme. The shadow side of that can be sleeping too much, but I'm talking about just trying to be really protective of a regular sleep pattern, which will help. And the final one is to be social. And what I mean by be social is to maximize connectivity. And so everybody who's on this call has figured out some way to use this technology to connect. And so that's one option. And then there's other ways, you know, that were shared early on to connect and to connect safely. And a reminder that this body mind that we all live in doesn't quite know much of the difference between reality and what's imagined. It's why we can imagine, for example, cutting a lemon and thinking about a very juicy lemon and taking half of that lemon and putting it to the tip of our tongue. And if you came along on this exercise with me, you might notice some puckering in the mouth or some salivary activity because our bodies don't quite know that our brain is creating that. And so in the same way our brain can create, you know, the need to activate the Bitsy Big Boy Bomberoo because of disagreements over buttering toast, the brain can actually be used to feel connection. And so we can look at pictures. We can look at pictures from a fun time in our lives, and that will actually produce a physiological effect. The reason we love giving a gift more than getting a gift is because of all the things that go into that process. We can write a letter or a card. Remember that thing called, you know, putting a card in the mail? And that just that process actually creates connection for us. And so like many, many things, you know, that we've seen great innovation at times when things were not going as planned. It's how we ended up with penicillin, all sorts of wonders that have been created of things not going the way that we planned. And can we use what we have here, really what we all kind of came, you know, pre-packaged with, our hardware and our software, to our advantage? And can we remember that, you know, we really are all tied in this inescapable network of mutuality. And so I want to end, you can go to the next slide, Katie. I want to end with just sharing a poem that I think captures that. It's a poem entitled Shoulders by Naomi Shihab Nye, written in 1952. A man crosses the street in rain, stepping gently, looking 2 times north and south because his son is asleep on his shoulder. No car must splash him. No car drive too near his shadow. The man carries the world's most sensitive cargo, but he's not marked. Nowhere does his jacket say fragile, handle with care. His ears fill with breathing. He hears the hum of a boy's dream deep inside him. We are not going to be able to live in this world if we're not willing to do what he's doing with one another. We are not going to be able to live in this world if we're not willing to do what he's doing with one another. The road will only be wide. The rain will never stop falling. And so why I too would love to imagine there is a different version of this moment that is less stressful. Here we are, and we're here in this moment of incredible collaboration and coming together and appreciation of this interconnected web. This coalition is a manifestation of that. There is no denying that. Here it is. And so I thank you for the opportunity to share these thoughts with you. I hope that they were useful, even if they weren't the 7-point steps to making decisions in this pandemic. And I really hope that they bring some element of understanding for all the suffering that's around us and why that's happening, and why caring for ourselves, our biology, our physiology, our hearts is so essential at this time. Thank you.
Doctor, thank you. I know I speak for everyone in saying how wonderful that was, and we so appreciate you being here and sharing that. I'm happy now to open the floor to folks for questions. And you can put your questions into the Q&A section. And if you go there and you look and you see a question we're going to ask, just vote that question up. So we'll know that lots of people have an interest in that. And if I could, Doctor, we have 2 questions for you to start with before we turn to our panelists. And you'll see on our slide the amazing folks that we have on our panel. But while people are putting their questions in, Doctor, someone asked, who was the author of the quote that you read?
Which quote? It may have been the one on compassion.
Yep.
I'm guessing that Miller Williams.
And the second question is, in your experience, these concepts that you talked about, especially around othering, are those things that little kids can grasp as well? And if they are, do you have some thoughts or resources about how to communicate that?
Yeah, it's a great question. I feel like our kids can actually teach us so much about not othering. I think we come to othering through our life experiences, and that, we are all fundamentally good. And I think kids, they really see that. So I actually think we have so much to learn from them, because they're not inclined to in-group and out-group collectively. They may, I don't like Billy because he always hogs the ball sort of thing, but they're not really inclined, particularly as young kids. Once we get to adolescence, that's all about figuring out who your tribe is. So, honestly, I think any of the books at this time that begin to unpack the racial divide are a really good model for how cultures and individuals within cultures can unintentionally learn about this othering, and you can sort of map that onto, right, butter side up, butter side down. But I would point people towards those as potentially a source.
Thank you.
And there's probably other panelists who are familiar with these concepts who may also have suggestions and ideas around that.
Let me start with that by opening that up to our other panelists. Anyone want to chime in on that question about little kids and how they can learn or be taught some of these concepts? All right, well, maybe that'll come up in our conversation. Let me start with our first question, and this is for any of our panelists who want to jump in. And I think this is probably a common scenario. How do you deal with family members who, in interacting with your elderly parents, don't want to do what the doctors are suggesting to keep them safe? And I think this is a situation not at all uncommon. One person has been taking all the precautions, going and providing some care, and other family members maybe not being so careful about their masks or social distancing, sharing meals with the elderly parents while they don't have masks on, and how that kind of all sometimes leads to a lot of tension and fighting in families. Some of these concepts, obviously, of how you can take a deep breath, but I think it's scary when, especially, this can have really bad consequences for these parents. What do we think are the best kinds of steps that people can take in addressing that? And I open that up to any of, either Dr. Runyan, to you, or to any of our panelists.
I'm happy to start while other people, I don't know how they will let you know or just unmute themselves. So that to me is an example, assuming the elderly family members are not in a facility where those regulations exist, which I assume they're not, and that they are sort of cognitively, intact. So it makes it even more difficult if there's some cognitive limitations, because does not allow the elderly family members to sort of state their preferences. So that's even more complicated. It certainly feels to me like that's a moment of suffering for the family members who are really trying to do what in their mind is the right thing, and other family members are actually creating a safety risk. And so there's a lot of suffering that's happening and a lot of anxiety that is generated by the group that's trying to stay safe and keep the family member safe. And so that's certainly a moment where any of the strategies to reduce one's own activation can be really helpful. The other strategy would really be to try to facilitate a communication that doesn't look like, the escalation because of the othering. And oftentimes the kind of communication that can be most helpful in that way is to really stay with sharing one's own experience. And that looks like a lot of I statements and sharing one's own anxiety around it and own fears, rather than you are doing this, you're not doing that. And when we feel really activated and that survival brain is kicking in, it's all about, it's all about safety. And so we get really defended in it, and we sort of can do the you. So trying to stay in that communication, that's kind of a nonviolent stance of communication, because really what you're highlighting in that is unmet needs. And when somebody has unmet needs, they're suffering, and to be able to communicate those. And then, it may not change somebody else's behavior, but it allows that person to feel like they have said what they need to say from their own experience. And I would love to hear other panelists.
And any of our panelists who want to jump in, just please unmute yourself. Dan?
Yeah.
Hi, this is Dan O'Leary. I'm the CEO at Mystic Valley Elder Services. So I really liked what Dr. Runyan had to say, and I'm not going to repeat what you said, Doctor, but I think there's a couple of points that you made are really very important. The first one being, let's talk to the older people. Let's talk to the parents. Let's find out what they think about this in a calm conversation and say, look, we all want to be with you. The grandchildren want to be with you, and we want to be with you next year. So how do we do this safely? And let, as you said, let them express. And now we're talking about people who can express their viewpoint. They don't have cognitive impairments. They don't have Alzheimer's disease, a whole other challenge. And I think maybe the other thing you were saying, if I listen carefully to what you were talking about, is engage the other family members and not have a finger pointing, yelling which side the bread is buttered on, right? And to talk about how do we engage with our parents? How do we see our parents, and how do we have the kids come over? But how do we do it safely? Can we do it in a way that we can have snacks outside and be socially distanced and try to have a calm, reasonable conversation? But I think the most important thing, it's not to talk about the parents, it's to talk with the parents, that they're not children, they're adults. And there is a measure, and this may be, we may have differences of opinion on this one, but there is balancing risk and safety. And most of us can't guarantee everybody will always be safe. I know we talk about living in a bubble, and the basketball players did, but the reality is most of us don't. And so we have to make reasonable decisions about risk and safety. And for those of us who have compromised immune systems and prone to getting the COVID and having a higher incident of really damaging effects, then we need to take that into account and think about our safety in terms of that risk level. So thank you very much for this presentation.
Thanks, Dan. Anybody else from any of our panelists? Another question is, several people know folks who've mentioned that this whole experience has left them feeling numb. Is that something of a normal feeling at this, given all that's happened over this stretch of time?
So I'd be happy to start off on that one. Yes, very normal. When I talked about the stress response, we often think about fight or flight, but it's actually fight, flight, freeze. Well, it's actually fight, flight, freeze, affiliate. But the freeze response is somewhat of what you're describing in being numb. And because this has been going on so long, we're really in a chronic state of stress. And so while it is very unpleasant, probably, and uncomfortable, it is not biologically, physiologically abnormal to feel numb. It's probably a lot of that freeze response that is coming in. It's a very, it's a primitive way of meeting acute stress and also chronic stress.
Any of our other panelists?
I'm not a behavioral health specialist, obviously, but I work with clients in the community, and I think people are exhausted too, and it makes you feel numb, I think. And so, really trying to take care of yourself as much as you can. And I know it's sometimes easier said than done, but, just getting a good night's sleep or shutting off like the social media, like people have talked about. And remembering, I think somebody started referring to it as like physical distance instead of social distance, which I think has helped people stay connected and take away some of that feelings of isolation and exhaustion, which I think leads to that, feeling numb.
We have a couple of questions that, Doctor, maybe if you want to address, and some of our panelists working with kids. I think one of the confusions, and even just today, a lot of conflicting information in the news about young kids, really toddlers. What's safe to do? Is it safe to take them to the playground? Is it safe to take them swimming? And how do you make the best decisions about those issues?
I will happily defer to the public health experts. I think to Dan's point earlier, there's a risk benefit calculation here, and I think this question is partly about decision making, but partly about that. So I don't know if there's anybody on the panelists that could speak to that more eloquently about the public health issue.
It's sort of a related question about how do you make the decisions about where kids go? And this is, again, sort of public health in terms of what the impact has been on kids. And, yesterday, a lot of reporting that in New York, they're seeing with all the schools open, very few kids testing positive, but then the precaution that's out there of worrying about if kids are carrying it to somebody else. What's a safer thing? Do you send your kids to a daycare center? Do you keep your kids in somebody's home? Who's making those safety assessments, and which is better for your family?
What about some of the public health folks who are on?
My name's Kathy Harlow. I'm not.
Hey, Kathy.
Oh, Kathy, there you are. I was looking for you.
I'm not in the public health, but I do run a program and deal a lot with children. And I think that it has to be a personal choice. I should show my video of what you feel comfortable with. I know myself, my children are older, so I take my grandchildren. But if I go to the park, I have my wipes and I'm wiping down things, and they're wearing their mask, I'm wearing my mask. And I try to go to parks that aren't like, if you live in Melrose, the Common, because that's so highly populated. So that, or go at off times, because I really feel like, especially these precious days like we had today, that it was actually colder in my house than it was outside, to be out there in the fresh air and to do things like that with them. As even if you just go for a walk, we went for a walk around the block today, counting pumpkins, looking at all the Halloween decorations that are out. So I think there's ways of getting them out and keeping them engaged without necessarily going to a park. There are scavenger hunts online that you can download that will say, look for an acorn, look for a leaf. So, I mean, there are opportunities to be out there, to give them the fresh air, to be socializing and not necessarily, going to the park if that's kind of a scary thought to you. Somebody else had asked about swimming lessons. And again, I would feel free if I know that there are places that are open and people are going, and that you have to ask the questions that you have as a parent. How many people in the class? What are your cleaning policies? Anything that will make you feel more comfortable bringing your child to wherever it is that you want to go. And as far as the daycares, I know that they have a lot of instructions that they have to follow. And I have not heard of any of our local preschools or daycares having to close because of any cases of COVID being detected in their agencies. So that's it for me.
Thanks, Kathy. And moving to kids a little bit older, we talked and Doctor, you spoke so much about how we feel sort of weary and, as someone described it, being numb. What about kids that are supposed to be going to school? And what's a good way to be motivating kids to participate in that remote learning? So many kids are talking about the kids that are a little bit older, just feeling very disconnected and only seeing their classmates, especially people that are fully remote. And how do you get them? We're all struggling with it. How do you get them up and getting on Zoom every day and staying on Zoom for a long time and paying attention and taking notes and doing everything that they're supposed to do? What's the best way to foster that or help them learn to take care of themselves to do that well?
Yeah, so I'm in this. I'm in this as a parent, and there's nothing that sort of you confront your expertise all the time as a parent. It's it's not fun. So I want to make a point too about I think we don't want to conflate personal choice with outcomes or what we're seeing, because I think we have a variable here that's really important, which is people's realities and people's resources. And so if somebody is sending their child to an in-person event or, daycare or something, we are at risk of making an assumption if we're choosing something different, that's a personal choice. And not everybody has an extended family around or resources or kinds of jobs that allow them the sort of flexibility. And so some of what people are choosing is really out of necessity. And that's where I feel like we just need to cast a very wide open net of grace at this time. And so, in terms of kids and going to school, I guess one thing I would say is we sort of have, it's helpful to take a little bit of a long view. And I guess this is part of how I feel about Halloween too. It's Halloween 2020, and it has been going on longer than any of us want, and will continue to go on for longer than any of us need it to go on. But if we can take a little bit of the long view and none of us are living our best lives. I'm not living my best life. I would love to talk to the person that's living their best life right now. Our kids are not living their best lives. Some kids are choosing to take some, time off of college if that's available to them, because they want a different kind of experience. And so I think a little bit of allowing, and, if they can't get excited about all of the classes on Zoom, can they really double down onto one subject, right? If it's just going to be one thing where they're really going to show up that way. I do worry a lot about, parents with young children at this time. And I really worry about these adults and emerging adults. I think it's really the adolescents and emerging adults. I think those are the two sort of groups developmentally, sort of psychologically that I worry about, and then physically, obviously, older populations and anybody who is compromised in some way, sort of on the physical side. But I think they're, the risks, if you will, are sort of not equally divided. And I think that those adolescents and emerging adults, sort of college students, really don't have a map for this. And despite the fact that they, a lot of them grew up with a device sort of in their hand, and they are finding ways to be social and connect because it is the currency of their time, that they're not as maybe as bothered by some of it as others. But it's I think it's really tough. And so I'm always a fan of incentive-based parenting rather than punishment based, and seeing if you can find the one class that they're really excited about or the one activity, and start small and build from there.
Annie, did you want to jump in on that question as well?
Yeah, I'd love to. So good evening, everyone. My name is Tayani Golar. I work with Wayside Youth and Family Support Network out of Medford, and we provide community-based therapeutic support to children, adolescents, young adults, and their families. And this is something that obviously has been coming up, ever since the springtime. The adjustment for families to go remote in the spring and then figuring out what was the summer like for them. And then adjusting to what was the fall going to be like. And I know that some communities are going into hybrid learning too. So having this kind of inconsistent schedule is really difficult if you're doing half days or a whole day here and then home the other time. So I wanted to start off by acknowledging kind of the equity issue that is in the middle of all of this too, because certainly in this decision-making around motivating or helping your child with accessing school or being wanting to participate in school, it really is thinking about what's going on at home at first. What are the supports that exist at home? And there are oftentimes teenagers that are helping their younger siblings with the technology. Families where English is not their first language, families that just the technology is something that's difficult, or they're working out of the home and these kids are really faced with having to be independent about their learning. When it comes to the getting back into the routine, the structure is something that is really, really important to think about, is figuring out a way to separate the school day, if that's possible, thinking about the space that the child is in with their remote learning, scheduling in the morning, what kind of routine can they get started so they feel like they are setting themselves up for this time in school, even though they are possibly at home. And the consistency with that is critical. And then in addition to that too, I think, as was already mentioned, is really having the patience and grace that this is a huge ordeal for many, many families, that your child or your teenager is not alone in this experience. With even those that are attending remote, there are challenges with not wanting to be on camera, feeling very uncomfortable with that. Also, any kids that are part of the special education program and the challenges that come up with meeting the accommodations as part of their individualized education plan. All those things come into account when we're talking about how do we motivate our kids to get onto remote learning. And there is no overall answer. Unfortunately, I don't have a blanket, this is what you do. What I can encourage is a routine and structure. What I can encourage is also really good, consistent communication with the school, with the teachers, with the school personnel, and also taking a moment to think about, and that engaging in a conversation with the student about how is this going for you? What is it that you need? Validating and recognizing how challenging this is, because I think what can feel really easy is to say just turn it on, just log in, just sit there. And it's really not as simple as that, because we have to remember the experiences that they've been having and trying to developmentally understand in the last 7 months. And that comes into play. And I think as Dr. Runyan was talking about kind of like the activation, I definitely feel like these students are in this activation mode of also trying to engage in a new school year with people that they don't know on screen. So I really highly recommend just taking it slow and talking about like, what is important to you? What is the goal for today? If the goal is really like, your feet are going to be on the floor out of the bed at 7:30, then that's what it is, like taking really small steps. And I welcome anybody else that, you know, works with kids to share a little bit more. This is like one of the primary things that we're hearing come up for many families that we were already working with, and then also now for new families that are looking for support. And that's really our work in the home right now.
I think one point that you brought up, which is really important, is I think as parents, it seems pretty easy to just say, go sit at the desk and get on when we're struggling with getting on to Zoom. So I think it is really a kindness that you need to be showing to your children as well, because it isn't as simple as what we're thinking. You know, I have to make dinner, I have to do the laundry, I have to supervise. All you have to do is sit there and be on the camera. So being able to show grace, as you said, to them. And so I think for one of the questions that both you and Dr. Runyan brought up a little bit is sort of taking that long view and appreciating that lots of people are struggling with this. But one of the questions that came up, and I think a lot of people have felt this, is you may be obviously unhappy that we're in this situation or feel cut off from routine, but know that your family's doing well, your health is okay, maybe no one's lost their job, and feeling guilty about that. And how do you deal with that? What can you do with that? Which I think is another piece that we can be thinking about. You know, how can you channel that? I'm feeling guilty about it, I could do something else.
I can take a stab at that. So, you know, feeling guilty by virtue of feeling gratitude and fortunate is an interesting paradox. So I love that, you know, people can take stock and feel very grateful that at this time, everyone around them is healthy. And, you know, there are some of these human emotions that we have that actually we can channel them in a really pro-social, proactive way. And so sometimes anger is one of those, guilt could be one of those. So if you feel very grateful for what's happening for you, I think like we heard in the beginning, there's a lot of suffering out there. And so if you are inclined in any way to individually or collectively within your families to channel that, like I trust that there's people in the coalition who, right, could give people very concrete suggestions of ways to be helpful. And when we saw this sort of, you know, I mean, the human spirit is just, you know, it is just limitless. We saw this in just people create, you know, made masks and distributed masks and food, all sorts of ways to be useful. So I think if that is an emotion that people are recognizing, it's pointing towards perhaps wanting to contribute in some way. And that's a beautiful thing. There's lots of people who could benefit from somebody's guilt-driven contribution.
Thank you. Amy Carol.
Yes, hi everyone. Good evening. This is Carol Plotkin from Melrose Wakefield Healthcare Behavioral Health. Thank you so much, Dr. Runyan, for your truly inspiring talk. I wanted to make sure that I said that on behalf of, I'm sure, the coalition. And I did want to add to the question about guilt and feeling gratitude. And what I see a lot happening right now is what I call, and pardon me, but I call it shoulding all over yourself. And that should, S-H-O-U-L-D, that we have a lot of people who I hear them saying, I should be doing this, I should be doing more, I should be making my child an A student, I should be helping out more in the community. And it's about tapping into who you are, what you can safely give without undoing your own self, and being okay with that, and having a lot of forgiveness for who you are. So really turn up how often you're saying should these days. I should be doing this. I should be visiting someone more. And just think about the smaller things, like when you go to the grocery store and you smile with your eyes at somebody else when your face is covered with a mask. That is helping other people. So there's so many things that you can do. I think if many people on this call thought about what they're already doing, it's an amazing amount. And we, all of us need to say thank you to each other for what you're doing. If it helps you to give more, then give more, but don't over give and deplete yourself. You have every right to say, this is all I can do. So be kind to yourself.
Thanks, Cal. And I hope that you have all found this evening as valuable as I have and leave with some better ideas of how to approach life in the next few weeks. And I'm going to turn it back to Dr. Carlat to say goodnight to us.
Yes, thank you. It's getting a little late, so I want to be respectful of everybody's time. And I just want to, on behalf of Melrose Wakefield Healthcare, I really want to thank everybody. Dr. Runyan, I mean, you came up with some amazing, very practical tips. I was taking some notes on some of your slides that I'm definitely going to be able to use for some of our coping strategy treatment groups on the inpatient unit. And I think a lot of other people will find them helpful. So I just want to thank everyone for attending. Prior to leaving, if you could use the polling tool to let us know your preferences for any future programs that we do. In the next few days, you'll receive some community resources to help you and your family, and also a survey to help us to continue to build some of this programming. And another note for any agencies represented, we do have Melrose Wakefield Healthcare has an open request for proposals on the website to address various behavioral health needs in the community. So with that, I'll say thank you very much and good evening, everyone.
Night. Night. Thank you. Be safe.